Good afternoon. My name is Tashawn Corbett Fulmer, and I am doing my final presentation for CPT. My topic is talking about electronic medical records, and as you can see clearly, I'm in a healthcare facility in which I work. I work in the emergency room, and what I wanted to show you was this is where we access our patient information here. Of course, this is where we do our vitals and everything here. But I want to talk to you more so about how we access those records. Let me give you just a little insight. I'm talking about the healthcare records of patients, and this is how we identify who the patient is, what medications that they're taking currently. We also can identify their last visits along with their last diagnosis. With healthcare records, all of this helps us to better care for the patient in the healthcare arena. Some of the history on the healthcare medical records would be basically it's a digital version of a patient's chart. The electronic health records are real-time, patient-centered records that make information available instantly and securely to authorized users. Some of the advantages of the electronic health records are enabling safety, more reliable prescription, helping promote reliable and complete documentations, also accurate and streamlined coding and billing. It helps us reduce costs through decreased paperwork. It improves safety. It reduces duplication of testing and improves health. Helping providers more effectively. It helps us to diagnose patients. It helps us to reduce medical errors and provide safe care. That's just some of what the electronic health records do. It helps us to provide up-to-date and complete information about patients at the point of care. When we look at the history, it goes back to 1972 when the first electronic medical system was developed. And in the 1990s, personal computers were becoming more affordable and the internet emerged. In 1996, the Healthcare Probability and Accountability Act, which is called HIPAA, it faced issues with healthcare coverage, privacy, and security in the U.S. Organizations, they began to shift to electronic systems to comply with these laws. So this is how we led into the electronic health records and retrieving data. For us, it makes our check-ins and our checkouts much efficient and much quicker. You know, it allows us to access the patient allergies, their medication. It allows us to view their medical history, secure sharing and storage of electronic health records. It also allows us to use less paper prescription management with e-prescriptions, clinical summaries provided to the patient at checkout. All of this are great advantages of having the electronic health records. With that being said, as we move forth into 21 up to about, I say 2026, you're going to see an increase with us using electronic records. You're going to see at least a 13 to 20% increase of us going paperless. With that being said, this basically wraps up what I have to say about us using electronic health records. Thank you, and I hope you enjoyed it.